Good evening, my name is Taylor Friedman and I'm going to be doing a speech on the 3 most common types of skin cancer. This is Cliff, Patty, Mark, Nicole, and Mark. Okay. Skin cancer is the most common form of cancer in the United States. More than 3.5 million skin cancers are in over 2 million people diagnosed annually, and 1 in 5 Americans will develop skin cancer over a course of their lifetime. Skin cancer has affected many people throughout the world and is a constant topic of discussion. There is always new information coming out about cancer that people need to be informed about. The reason for my speech is to inform my audience about the 3 most common types of skin cancer: basal cell carcinoma, melanoma, and squamous cell carcinoma. I have conducted my research through the university websites, cancer research websites, and articles about these 3 types of skin cancer. Basal cell carcinoma is the most frequently occurring form of cancer and also one of the easiest to treat. Melanoma is the most dangerous form of skin cancer and is only treatable if caught early. Squamous cell carcinoma is the second most common form of skin cancer and is always treated if detected in early stages and removed promptly. Basal cell carcinoma is a controlled growth or lesions that arise in the skin's basal cells, which line the deepest layer of the epidermis. Basal cell carcinomas look like small sores, red patches, growths, shiny bumps, or scars. They are usually caused by a combination of cumulative and intense sun exposure. Basal cell carcinomas, also known as BCCs, are almost never spread further than the original tumor site, and in extremely rare cases, it can spread to other parts of the body and become life-threatening. In 2015, the Skin Cancer Foundation stated, in 2010, an estimated 2.8 million cases of BCC are diagnosed in the United States. The figures have contributed to climb. This type of skin cancer is known as the most frequently occurring forms of all skin cancer. It is also a good idea to check your body every so often to make sure you do not find any out of the ordinary outer layers of the skin. There are multiple ways you will be able to tell if you have basal cell carcinoma. One warning sign to look at is an open sore. If the open sore bleeds, oozes, or crusts and remains open for a couple of weeks, heals, and then reopens and bleeds again, you will know that's one of the signs. Non-healing sores are a very common warning sign to look for, and a reddish patch or irritated area, usually found on the face, chest, shoulders, arms, or legs. These patches can crust, itch, or hurt, but it is also common with no discomfort for some people. The third warning sign can be a shiny bump that is pearly or clear and is often pink, red, or white. In some cases, the bump will appear tan, black, brown, and is typically confused with a mole. A pink growth is often common. The growth will be slightly elevated with a rolled border and a crusted indentation in the center of it. The growth will start to slowly enlarge and form tiny blood vessels on the surface of it. The final warning signs may be scar-like areas that is white, yellow, or waxy. This warning sign indicates the presence of the invasive basal cell carcinoma that is larger than it appears to look on the surface of the skin. There are many ways to develop skin cancer, but only one major way when developing BCC. A long-term sun exposure throughout your lifetime and occasional but intense exposure will combine to cause damage that can lead to basal cell carcinoma. Most of the time, basal cell carcinoma will occur on parts of the body that is constantly being exposed to the sun, typically in the face, ears, neck, scalp, shoulders, and back. In rare cases, these tumors can develop in unexposed areas, such as combining in contact with arsenic, exposure to radiation, open sores that won't heal, chronic inflammatory skin conditions, and complications of burns, scars, infections, vaccinations, and even tattoos. Whoever has a history of sun exposure has a chance of developing basal cell carcinoma. People who have the highest risk are people who have fair skin, blonde or red hair, blue, green, or gray eyes. In some cases, but not all, BCC can be hereditary. The cases are rare in children, but dermatologists have reported that more people in their 20s and 30s that are now being treated for skin cancer. Usually this tumor is found in more men than women, but recently numbers have showed that women are catching up. A lot of the time, people who work long hours outside in the sun or enjoy their free time lying in the sun are susceptible to developing BCC. People who have developed basal cell carcinoma once already are at a risk of developing another over the years. If the cancer does reoccur, your dermatologist should recommend a different form of treatment to prevent it from ever coming back. There are 9 different treatments to try to get rid of your basal cell carcinoma. The 9 are curettage, Mohs micrographic surgery, excisional surgery, radiation, cryosurgery, photodynamic therapy, laser surgery, or topical medications, and oral medication for advanced BCC. In order to choose the right choice of treatment, you should have depended on the type of the size, location, and depth of the penetration of the tumor, patient's age, and general health. Mohs surgery has the most effective technique by removing BCC. Typically, the pain and discomfort for the procedure is minimal, and the pain after the surgery or procedure is really rare. Next, I'm going to be talking about the second most common and also most dangerous form of skin cancer, melanoma. So what is melanoma and how do we get it? This cancer can show warning signs, but it may be too late once you discover those signs, and it usually is. Melanoma cancerous growths develop when unrepaired DNA damages to the skin, usually caused by ultraviolet radiation from the sun or tanning beds. Trigger mutations that will lead to the skin multiplying quickly and form malignant tumors. Melanomas often look like moles, and some develop from moles. Usually melanomas are black or brown. They can also be skin-colored, pink, red, blue, purple, or white. This cancer kills an estimated of 9,940 people in the United States annually. If melanoma is caught and treated early, it is also always curable. But if it is not, and the cancer advances and spreads to other parts of the body, it is deadly. Once it has spread, it becomes hard to treat and can be fatal. According to the American Cancer Society, it is estimated that more than 135,000 new cases of melanoma in the United States are diagnosed in a year. 42,670 melanomas are found in males, and 31,200 are found in females. Warning signs of melanoma are A, B, C, D, and E. Asymmetry is if you draw a line through the mole, the two halves will not match. This is distended, and this is just a black growth. Border. It is uneven and the edges will be notched. Over here, the edges are raised. Color. Malignant melanoma has a variety of colors. The benign is pink and looks like skin color, and the malignant is brown over here and gets completely black in the center. Diameter. It is larger than an eraser on the pencil in 6 millimeters. If it is larger than 6 millimeters, it is a big concern. And evolving. Malignant melanomas will change in any of the above characteristics that I have mentioned. Melanoma has 4 basic types that are different in their own way. The 4 basic types of melanoma are superficial spreading melanoma, lentigo maligna, acral lentiginous melanoma, and nodular melanoma. Superficial spreading melanoma is the most common type, occurring in about 70% of all cases and is usually seen in young people. The first sign is an appearance of a flat or slightly raised discolored patch and is fairly asymmetrical in form. This type of melanoma can appear in a previously benign mole. It can also be found anywhere on the body. It most likely occurs in the trunk of a man, the legs of a woman, and the upper back of both men and women. Lentigo maligna also remains close to the skin surface for a while and usually appears flat or elevated with a tan brown or dark brown discoloration. This type of melanoma is often found in the elderly, arising on chronically exposed, sun-exposed damaged skin on the face, arms, ears, and upper trunk. Acral lentiginous melanoma is different from the first 2 melanomas I have mentioned already. It usually appears as a black or brown discoloration under the nails or on the soles of the feet or palms of the hands. This type of melanoma is sometimes found in dark-skinned people and is also most common melanoma in African Americans and Asians, and the least common among Caucasians. The last type of melanoma is nodular melanoma, which is usually invasive at the time it is first diagnosed. This tumor is recognized when it becomes a bump and is usually black. The most common location it is found in is the trunk, legs, arms, and the scalp in men. This is the most aggressive type of melanoma and is found in 10 to 15% of cases. Everyone is at risk, but there's a greater risk depending on several different things: sun exposure, the number of moles on the skin type, and genetics. Heredity plays a huge role in melanoma. 1 in every 10 patients diagnosed with melanoma has a family member with a history. Each person with a first-degree relative diagnosed with melanoma has a 50% greater chance of developing the disease than most people, and therefore you are in a melanoma-prone family. Melanoma comes in 4 stages, and each stage is worse than the first one. The stages are 0 to 4. If a person has stage 0 melanoma, that means it is non-invasive and has not penetrated below the surface of the skin. Meanwhile, stages 1 tumors would have already invaded the skin, but they are small, non-ulcerated, and are growing at a small mitotic rate. Stage 2 tumors are large and may be ulcerated. They are considered intermediate melanomas. Stage 3 melanoma will have already spread through the lymphatic system to a regional lymph node where the cancer has started. This stage is split into subgroups A, B, and C, and it all depends on the size and number of lymph nodes covered in melanomas and if the tumor is ulcerated or not. Stage 4 is when the melanoma has spread through the bloodstream to other parts of the body in certain locations of the skin, lymph nodes, and other organs, including the lungs, liver, or brain. No matter what stage of melanoma you have, it is always a good idea to start a treatment plan as soon as possible. Depending on what stage of melanoma you have, there are 4 different treatment plans to try to get rid of your cancer. The first step is treating the cancer is removing the melanoma by cutting it out. We want to get as much of the cancer out of your body as possible to make chemotherapy, outpatient or office surgery, setting the margins, and Mohs micrographic surgery possible. Once you start noticing anything abnormal on your body, you should go to your dermatologist right away. Once your dermatologist has taken a sample of the infected area of the skin, he or she will send it to the lab and then will further direct you once he or she gets the results from the lab back. If the results come back that it is melanoma, your dermatologist will then recommend you to go to a surgical oncologist, who is a doctor that uses surgery to treat cancer, a medical oncologist, who is a doctor who treats cancer with medications such as chemotherapy, immunotherapy, or targeted therapy, or radiation oncologist, a doctor who treats cancer with radiation therapy. Melanoma is a very hard cancer to treat, but it is possible depending on the stage of melanoma you have. It is always important to go to the dermatologist to get your skin checked out every year to make sure every freckle and mole looks okay. The final most common form of skin cancer is squamous cell carcinoma, also known as SCC. A squamous cell carcinoma is an uncontrolled growth of abnormal cells occurring in the squamous cells, which composes of large portions of the skin's upper layer. According to the Skin Cancer Foundation, it is estimated that over 700,000 cases of SCC are diagnosed each year in the United States, and between 3,900 and 8,800 people die from the disease in the United States in 2012. SCC typically appears as thick, rough, and scaly patches that bleed if bumped, scraped, or scratched. They usually look like warts and sometimes appear as open sores with a raised border and a crusted surface. If there is any change in pre-existing skin growth, such as an open sore that does not heal, or the developing of skin growth, you should immediately go visit a dermatologist. Squamous cell carcinoma is common in people with fair skin, light hair, and blue, green, or gray eyes. If anyone has a history of substantial sun exposure, is at a high risk as well. If anyone has previously had basal cell carcinoma, is more likely to develop squamous cell carcinoma. SCC is twice as common in men than in women, and most of the time this cancer appears in people over 50. The people of the Skin Cancer Foundation stated more than 419,000 people in more than 419,000 cases of skin cancer in the United States each year are from indoor tanning, and the majority of skin cancer is found in African Americans. People who visit tanning beds frequently have a 2.5 higher chance of developing squamous cell carcinoma than people who don't. Most of the time, skin cancers arise in burns, scars, ulcers, long-standing sites, and previously exposed to x-rays or certain chemicals. Squamous cell carcinomas can be easily treated if caught in early stages and removed promptly. During my research, I came across 8 different treatment methods. The 8 different treatment methods I came across are similar to the methods of basal cell carcinoma. These 8 are Mohs micrographic surgery, excisional surgery, electrosurgery, cryosurgery, radiation, photodynamic therapy, laser surgery, and topical medications. If SCC is left untreated, they will eventually penetrate the underlying tissue and become discomforting and disfiguring. Once you notice something abnormal in your skin, you will go to your dermatologist and they will take a biopsy, which will be examined, and then from there you will have a final diagnosis. The choice of treatment will be based off the tumor's type, size, location, depth of penetration, as well as the person's age and general health. Today I discussed basal cell carcinoma. Second, I discussed melanoma. And finally, I discussed squamous cell carcinoma. I hope after listening to my speech, I've informed you enough on the 3 most common types of skin cancer: basal cell carcinoma, melanoma, and squamous cell carcinoma. It is always important to wear sunscreen when you go out in the sun and to try to stay out of the sun as much as possible. Remember, most skin cancer is hereditary, so if the cancer runs in the family, it is a good idea to go to the dermatologist yearly to check yourself out regularly to make sure there are no abnormal growths or discoloration. Thank you.